Hi guys, welcome back to the channel. So this week we are talking about a very hot topic in the industry at the moment, which is the Russian lip technique. What is it? What's it all about? Is it any good? And what are the risks? So the Russian lip technique seems to be very hot in the press at the moment. I'm not really sure why it's being called the Russian lip technique because it's been around for quite a while, certainly since I've been injecting. It seems to just be a trend at the moment. People also call it tenting or fencing, and it basically involves doing perpendicular injections into the lip. So you go from the border down into the body of the lip multiple times, making little columns in the lip, and that boosts the volume and flips the lip up and can give quite a nice shape to the border as well.
Do you prefer a more robust product for this, or do you like something that's softer?
You need to use a robust product for this technique. So something like Belotero Intense, that's probably my favorite product to do the Russian lip technique or tenting with. It's soft enough that it feels like natural lip tissue once it's integrated, but it gives you that lift. If you use something that's a little bit softer, it will probably still look nice, but you just won't get quite the same result.
I've used Balance with tenting technique, and it looked great, but it didn't last that long. That's what I think.
So a stronger product is going to last a bit longer as well. You get a nicer result.
So this is something that I personally would do if you were trying to get more vertical height in the lip.
Exactly. Okay guys, so to make it a little bit easier to understand the technique, I thought I'd just draw it out. So basically, this is the Russian lip technique. So quite simply, it is little struts of filler going from the border down into the lip, like I said before. And on the bottom, what I've tried to show you is that you can place some struts there, probably not as many as the top, but you'll focus them on the tubercles of the lower lip to give some nice kind of shape and projection.
So pitfalls, what would the pitfalls be?
So yeah, the Russian lip technique does come with some risks. Not significant risks if you're in the hands of a good injector. You need to know your anatomy, as for any injections on the face, but really importantly in the lip, you have two major arteries. One on the top lip called the superior labial artery and one on the lower lip called the inferior labial artery, and they're branches of your facial artery. And the facial artery supplies all the blood supply to the external face. If you block any part of that, you're at risk of necrosis, as many of you are aware, that's tissue death, or embolism, where the filler can actually shoot off up another branch of the artery, and ultimately that can cause blindness. So the depth of your injection is so important to avoid those arteries that if it's done by a safe and qualified injector, you should be able to reduce those risks significantly.
Should we show where the arteries are?
Why not? Okay guys, this is an anatomy lesson. Kish is my willing victim, donating his body to medical science. So I'm going to show you the arterial supply to the face and the lips in particular. So I'm going to keep it as simple as possible. We have our external carotid artery that comes up in our neck. It branches to form the facial artery at the angle of the jaw here. It will then wiggle its way up the side of the face, and branches will move up. But for the lips, we have the superior labial artery that wiggles in and out of the top lip, and the inferior labial artery which wiggles its way in and out of the bottom lip, and it joins the vessel on the other side.
That's actually a permanent marker.
Sorry, Kish. But the importance of this is that with an artery that is so wiggly, you can never really predict exactly where it's going to be, but it tends to be at a certain depth. So you need to see an injector who really understands the anatomy and make sure they don't inject too deep towards that artery, because once it's blocked, you're in for some serious trouble.
And even if it does get blocked, I think the important thing is you go to someone who can basically reverse what they've done so that you're out of the danger area.
Exactly.
Actually, that's quite an interesting point though, because it also explains why you can get bruising from having lip injections.
Exactly. So if you are unfortunate enough to catch an artery, you are going to get a significant bruise. It's part and parcel of the risks, I suppose, of a lip treatment. Most lip injections will result in a minor bruise, but again, if you're unlucky and catch an artery, that bruising can last for a couple of weeks. So what you probably want to know is, how long does the treatment take, and is it any different to your other lip treatments at the clinic? Well, the answer is it will probably take us about 5 to 10 minutes to do the lip augmentation, and the cost is the same as a normal lip augmentation. I would normally not inject more than 1 ml in the lips per session. So Kish, why don't you tell everybody at home how long you'd expect a Russian lip augmentation to last?
I think for this technique, and considering the type of product we're going to use, we can expect it to last anywhere between 6 to 9 months. And the good thing about it is that if you have the treatment repeated at that time, the results seem to last even longer, and actually the results look better as well.
True.
I actually really like this technique because you can mix it in with other ways of doing lip augmentation. So it doesn't just have to be like exclusively this particular technique. This is something that I've had done myself as well a few times.
I had this done the first time I had lip treatment, and what was good about it was that it's really quite quick. So if you're maybe a little bit nervous about treatment, then it's a really nice, quick way to have your lips done.
But don't expect no swelling because you're having lots of needle pokes in those lips, more than a normal lip augmentation. So you've got to be a bit brave and expect a bit of swelling and downtime.
Okay guys, so that's it for this week. I hope you enjoyed the video. If you've ever had this particular technique done, please let us know in the comment section below, and we will see you again next week for another video. See you later.